I had previously made a video on harm reduction, although I incorporated e-cigarettes into it, which turned it into a really long video. So I'm going to try to do a short video on my views on harm reduction. Public health, there's a lot of people in this field who really feel that harm reduction is a very important component of what can be done at this point in time to help smokers, to reduce their risk that cigarettes pose. And I understand why they feel the way they do. In fact, if I shared their beliefs about how difficult it is to quit smoking, or many of their beliefs that it's almost impossible for people to quit smoking, if I shared those thoughts, I would probably be in the harm reduction camp of saying this is really important. This should be the cornerstone of what's being done at this point in time. The reason that so many of them push harm reduction as a strategy, because they're working with the basis that people can't quit smoking, that the vast majority of people who try to quit fail. I mean, that's what the literature is telling them. The vast majority of people who try to quit, only 5% of people can seem to quit on their own. That's what they'll keep on telling you. If I believe that, yes, harm reduction makes perfect sense. I don't believe that. I don't believe that because I see numbers different. I see that we have more former smokers than current smokers in the United States today. That's telling me that over half the people who used to smoke have quit smoking. So to be working on the premise that it's almost impossible to quit, when here you have, again, the majority of people have quit. Their basic premise is wrong. That's how I see it. Also, from my personal experience of working with smokers. I get smokers in programs, or I used to when I did live programs, but we see them online all the time now too. People who thought it was impossible for them to quit smoking, that just quitting smoking was totally undoable. There was no way they could quit smoking. Who went on to quit smoking? That is, the more and more you see this, the more and more you start to realize quitting smoking is possible. When I was doing clinics, this was a regular occurrence where people would come in and say that they're the only smokers they know. None of their family smokes. None of their friends smoke. They're the only smoker left and they can't quit. And I would often ask, so all the people they know, their family, their friends, they just all never smoked? And oh no, most of them, they remember in the past that, they were surrounded by smokers, and now these people don't smoke anymore. Now, these weren't people who came to me to quit. These were people who just quit on their own, who I'm sure in many cases they all thought they were perfect smokers too, couldn't quit. They'd quit smoking. And then I'd get the last holdout, the smoker who couldn't quit in a program, and they would quit smoking. Well, you just see this over and over again, and it changes perception that quitting is possible. I really believe anyone can quit smoking. I don't care how much they smoked. I don't care how long they smoked. If somebody really wants to quit, it can be done. The material that I'm sharing with you is trying to help you understand how you can do it. Don't work with the basis that it's impossible. Is harm reduction making sense if you can't quit? Sure, harm reduction makes sense if you can't quit. But it's a erroneous premise. You can quit smoking. You just need to understand how to do it. Now, I want to point out one of the reasons that a physician may feel that it's hard to quit or impossible for some people to quit is they've been telling their patients to quit smoking for years. They've been telling their patients to quit smoking for decades with the ultimatum. You've got something wrong. If you don't quit smoking, you will die. These doctors saw these patients go on to not quit and to die. You see that over and over again. Well, sure, you start to think, oh, it's impossible for those people to quit. The problem was the doctor really didn't give enough information on how to help this person quit smoking. See, you need to deliver two messages to people if they're going to successfully quit. One is, yes, the first message they gave, how important it is, that their life is dependent on it. Most smokers' life are dependent on the fact that they quit smoking. If they don't quit, they're going to be in trouble. They're going to ruin their health, and again, half of them are going to go on to die from their smoking. So yes, that first message was crucial to be delivered. But there's a second message that needed to be delivered, and that's how to do it, and giving them a real viable plan. The way most doctors are trained on how to help people quit smoking, again, it's to put them to a pharmaceutical device. That's not going to work. So if they would learn, again, what really can help people to quit smoking and to stay off, and again, that's a key piece of information, how to stay off. If they can share that concept along with the message of why to quit, they could see a lot more success than they're seeing right now. But again, they're not being trained on that. And if anything, they're being trained not to deliver the information that people need to get. The information you need to get, that's what I'm trying to supply in all these materials. If you're going through it, the messages you should be getting out of them is, you are fighting for your life to quit smoking. It is a worthwhile fight considering what you're fighting for. That's the first message, but the second one is how to do it. How to do it is not very complicated when it comes down to it. How to quit smoking and to be able to stay off over the long term. It's understanding the importance of making a commitment and then sticking to that commitment to never take another puff.